Surgical site infections. Identify risk factors and implement strategies to reduce the incidence of infections. Antibiotic stewardship, rational use of antibiotics to prevent resistance and ensure efficacy in treating infections. Inflammatory response. Understand the phases of inflammation and their impact on surgical healing. Abscess management. Incision and drainage remain the mainstay treatment for abscesses. Cellulitis. Treat with appropriate antibiotics. Recognize signs of systemic involvement. Necrotizing fasciitis. Rapidly progressing infection requiring aggressive surgical debridement and antibiotics. Osteomyelitis. Long-term antibiotics and potential surgical debridement for bone infections. Catheter-associated infections. Implement measures to reduce risk, including aseptic insertion and timely removal. Fungal infections. Identify and treat with appropriate antifungal agents, particularly in immunocompromised patients. Preoperative assessment. Evaluate patient history, physical examination, and relevant investigations to identify risk factors. Informed consent. Essential for legal and ethical reasons. Ensure patient understands procedure, risks, and alternatives. Nutritional support. Preoperative nutritional status. Impacts recovery. Consider supplements for malnourished patients. Nutritional support. Preoperative nutritional status. Impacts recovery. Consider supplements for malnourished patients. VTE prophylaxis. Use pharmacological and mechanical methods to prevent venous thromboembolism in at-risk patients. Preoperative fasting. Typically 6 hours for solids and 2 hours for clear fluids to reduce aspiration risk. Patient positioning. Proper positioning to prevent nerve damage and pressure sores during surgery. Monitoring. Continuous monitoring of vital signs is crucial during surgery to detect and address complications early. Blood transfusion. Indicated for significant blood loss. Cross-match and prepare units preoperatively. Anesthetic risk assessment. Use tools like ASA classification to evaluate and communicate anesthetic risks. Tumor staging. Accurate staging guides, treatment plans, and prognostication. Includes TNM classification. Biopsy techniques. Select appropriate method, like needle, excisional, based on tumor location and size. Margins in cancer surgery. Aim for clear margins to reduce recurrence risk. May require intraoperative assessment. Neoadjuvant therapy. Preoperative chemotherapy or radiotherapy to shrink tumors and improve surgical outcomes. Sentinel lymph node biopsy. Minimally invasive technique to evaluate regional lymph node involvement. Adjuvant therapy. Postoperative chemotherapy, radiotherapy, or hormonal therapy to reduce recurrence risk. Palliative surgery, aimed at symptom relief and improving quality of life in advanced cancer patients. Multidisciplinary approach. Collaboration among surgeons, oncologists, radiologists, and pathologists for comprehensive care. Genetic counseling, offered to patients with hereditary cancer syndromes to inform surveillance and preventive strategies. Survivorship care, long-term follow-up to monitor for recurrence, manage late effects, and support patient well-being. Splenic injury, non-operative management preferred for stable patients. Surgical intervention if unstable. Liver injury. Management ranges from observation to surgical repair depending on severity. Pelvic fractures. Stabilize with pelvic binders and assess for associated vascular injuries. Bladder and urethral injury. Suspect in pelvic trauma with hematuria. Confirm with retrograde urethroplasty. Compartment syndrome. Early diagnosis and fasciotomy are crucial to prevent muscle and nerve damage. Primary survey. Follow ABCD approach, airway, breathing, circulation, disability, exposure for initial assessment. Head injury, assess using Glasgow Coma Scale, GCS. Monitor for signs of raised intracranial pressure. Cervical spine protection. Maintain cervical spine immobilization until injury is ruled out by imaging. Chest trauma. Identify and manage life-threatening conditions like tension, pneumothorax, hemothorax, and flail chest. Abdominal trauma. Perform fast. Focused assessment with sonography for trauma. to detect intra-abdominal bleeding.
Fracture classification. Understand different types, like open, closed, comminuted, to guide management. Initial management. Immobilize and stabilize fractures. Apply splints or casts as needed. Open fractures require prompt irrigation, debridement, and antibiotic prophylaxis to prevent infection. Dislocations. Perform reduction techniques. Assess neurovascular status before and after reduction. Spinal fractures. Maintain immobilization and assess for neurological deficits. Consider surgical stabilization. Soft tissue injuries. Manage with RICE, rest, ice, compression, elevation, and appropriate rehabilitation. Compartment syndrome. Monitor for pain, pallor, paresthesia, paralysis, and pulselessness. Treat with fasciotomy. Tendon injuries. Surgical repair may be necessary for complete ruptures. Early intervention improves outcomes. Neurovascular injury. Assess for and promptly address any associated neurovascular compromise. Pediatric fractures. Consider growth plate involvement. Green stick and buckle fractures are common. Clinical trials. Understand the importance of randomized controlled trials, RCTs, in generating high-quality evidence. Systematic reviews. Comprehensive summaries of research studies to provide evidence-based recommendations. Meta-analysis. Statistical method to combine results of multiple studies, enhancing the power of findings. Levels of evidence. Hierarchy from systematic reviews and RCTs to expert opinion and case reports. Bias in research. Recognize types of bias like selection, performance detection that can affect study outcomes. PICO framework. Formulate clinical questions using patient, intervention, comparison, outcome for focused searches. Critical appraisal. Evaluate research studies for validity, relevance, and applicability to clinical practice. Clinical guidelines. Follow evidence-based guidelines to standardize care and improve patient outcomes. Cochrane collaboration. Source for high-quality systematic reviews and evidence-based resources. Translational research. Bridge the gap between laboratory findings and clinical practice to enhance patient care. Beneficence. Act in the best interest of the patient to provide beneficial care. Non-maleficence. Do no harm. Avoid interventions where potential harm outweighs benefits. Justice. Fair distribution of healthcare resources and treatments among patients. Confidentiality. Maintain patient privacy and protect personal health information. Clinical governance. Framework for maintaining and improving quality of patient care within healthcare systems. Risk management. Identify and mitigate potential risks to enhance patient safety and reduce adverse events. Audit. Regular review of clinical practices and outcomes to ensure adherence to standards and identify areas for improvement. Medical legal issues. Understand legal responsibilities and implications of surgical practice, including negligence and malpractice. Informed consent. Ethical and legal requirement. Ensure patient comprehension and voluntary agreement. Autonomy. Respect patients' right to make decisions about their own health care. Total hip replacement. Indications include osteoarthritis, rheumatoid arthritis, and a vascular necrosis. Aim for pain relief and mobility restoration. ACL reconstruction. Indicated for ACL tears. Use autograft or allograft for ligament reconstruction. Spinal fusion. Used for conditions like spondylolisthesis and degenerative disc disease. Aims to stabilize the spine. Rotator cuff repair. Surgical intervention for torn rotator cuff tendons to restore shoulder function. Arthroscopy. Minimally invasive procedure to diagnose and treat joint conditions, common in knee and shoulder surgeries. Fracture fixation. Use of internal, plates, screws, or external fixation devices to stabilize and heal fractures. Bone grafting. Augment bone healing in cases of defects or delayed union, can be autograft or allograft. Osteotomy. Surgical cutting of bone to correct deformities and realign joints, commonly performed on the knee. Clubfoot treatment. Early intervention with Ponseti method or surgical correction to achieve functional alignment. Scoliosis management. monitoring, bracing, or surgical correction based on severity and progression of spinal curvature.
Pain management. Utilize multimodal analgesia to control postoperative pain and enhance recovery. Fluid balance. Monitor and manage fluid intake or output to prevent dehydration or fluid overload. Early mobilization encourages faster recovery and reduces the risk of complications like deep vein thrombosis. Wound care. Regular assessment and appropriate dressing changes to promote healing and prevent infection. Nutrition. Early enteral feeding supports recovery and reduces complications compared to parenteral nutrition. Respiratory care. Encourage deep breathing exercises and use of incentive spirometry to prevent atelectasis. Cardiac monitoring. Continuous monitoring in high-risk patients to detect and manage arrhythmias or ischemia. Renal function. Monitor urine output and serum creatinine to detect and manage acute kidney injury. Infection surveillance. Regularly check for signs of infection and implement timely interventions. Patient education. Instruct patients on wound care, activity restrictions, and signs of complications to ensure proper recovery. Aseptic technique. Essential to prevent infections. Includes hand washing, sterile gloves, and maintaining a sterile field. Surgical instruments. Proper selection and handling of instruments to enhance surgical efficiency and patient safety. Sutures and staples. Choose appropriate materials and techniques based on tissue type and healing properties. Laparoscopy. Minimally invasive technique offering reduced recovery time and less postoperative pain. Electrosurgery utilizes electrical currents to cut tissue and control bleeding, requires careful handling to avoid burns. Robotic surgery enhances precision and control in complex procedures, but requires specialized training. Tissue adhesives, used for wound closure, offer quicker application and reduced infection risk compared to sutures. Surgical drains, placed to remove fluid collections and prevent complications like abscess formation. Ergonomics in surgery, proper posture and equipment set up to reduce surgeon fatigue and musculoskeletal injuries.